Hello, everybody. Hi. Thank you all for coming tonight. I'm really pleased to have met some of you downstairs, faces to the virtual people I've been talking to for the last year or so. And it's been really nice to meet everybody in person. Just want to begin by saying Happy Environmental Week. We should be celebrating, and it's kind of a week to celebrate periods and all things periods and menstruation. My name is Helen Lynn. I'm the Environmental Campaign Manager at Wen. I'm also the Health Advisor there, and I've been working there for quite a number of years. I just want to draw your attention first to the kind of outline for all the speakers that's on your seats. And there's a really good information pack as well that you can download with our new campaign about breaking up with toxic periods. It's online and on our social media as well. I wanted to just give you an outline of how the evening's going to go, the format. I'm going to begin by introducing all our fantastic speakers. I'm actually blown away they've said yes and they're actually here sitting on the stage. And then I'll do a brief run through of the issues we're going to be discussing. Then each speaker will be talking about their work for 5 minutes, and we'll have then some specific questions to ask them about the issue. Then audience members will have 5 minutes to introduce yourselves to each other and discuss what you've heard and think of some questions to ask us, and we'll have 20 minutes to do that. Then we'll have an audience Q&A, and we hope to finish up at 9 o'clock, if that's okay. So I'm going to run through the introductions first. So on my right-hand side, Miss Karen Joash. Karen is a consultant in obstetrics and gynaecology at the Imperial College Healthcare NHS Trust, Queen Charlotte's, and the Chelsea Hospital site. And she holds multiple roles shaping maternal and reproductive health globally. As a scientific advisor to the Global Maternal Health and Tomlinson charity, she spearheads initiatives to improve awareness of environmental effects on health, particularly during pregnancy and infancy. And additionally, she serves as the head of postgraduate training for obstetrics and gynaecology and community sexual and reproductive healthcare in London, overseeing an impressive 26 hospitals. Where does she get the time? She wrote the foreword for the landmark Black Child Clean Air a report, which highlighted the extent outdoor and indoor air pollution, which affects us all, regardless of background or race. And she serves on the various boards at the Royal Hospital, the Royal College of Obstetricians and Gynaecologists, and the Royal College of Psychiatrists. So welcome, Karen. Big round of applause. And to my left, Dr. Maria Tomlinson. She is a lecturer in public communication and gender at the University of Sheffield, and her research explores the impact of health communication on social inequalities. She is the author of 2 monographs and soon to be published book, The Menstrual Movement in the Media, Reducing Stigma and Tackling Social Inequalities, to be published next month? Yeah. Next month. And soon to be, and also From Menstruation to Menopause, The Female Fertility Cycle in Contemporary Women's Writing in French in 2021. The interesting thing about Maria's work, and there's lots of interesting things, is that she considers the impact of public communication on social perceptions of social inequalities in health. And this includes considering how the media can reinforce stigma, spread misinformation, and erase social inequalities. She has won awards from the University of Sheffield and the British Standards Institute for her knowledge exchange and impact work. So welcome, Maria. And then on the far left-hand side, we have Baroness Natalie Bennett. Thank you very much for joining us, Natalie. And Natalie has been a Green Party member of the House of Lords since 2019. I'm sure she needs no introduction to a lot of you. She is leader of the Green Party. She was leader of the Green Party from 2012 to 2016, and she focused on getting human life within planetary boundaries. Very difficult task, I think, with a particular focus on novel entities, meaning pesticides, plastics, and pharmaceuticals. She's been a feminist since the age of 5, and she worked as a volunteer with the National Commission of Women's Affairs in Thailand back in the 1990s, when she also worked on women's issues for the World Health Organization. Her new book, which you should run out and buy straight away, Change Everything, How Can We Rethink, Repair and Rebuild Society, came out in March, and it's a must-read. Welcome, Baroness Bennett. And so to our last panelist, but not least, thank you very much for joining us, Tanya. This is Honourable Tanya Verge. She is an MP in the Parliament of Catalonia and a former Minister of Equality and Feminisms, May 21 to August 24 in the government of Catalonia. I think it's actually amazing they have a Minister of Equality and Feminisms. In March 2024, the Catalonian government launched a global first that institutes the right to menstrual equity in order to further gender justice, social justice, and climate justice. And that was the free distribution of reusable menstrual products through local pharmacies to all girls and women and other menstruating people aged 10 to 60. It's a world first. She is also a full professor of politics and gender at the University Pompeu Fabra, I hope I pronounced that properly, Tanya, where she led the Equality Unit from 2014 to 2021. Her research focuses on how political institutions are patterned to gender and on resistance to the adoption and implementation of equality policies. She has advised national institutions and international organizations on gender sensitizing initiatives and feminist redesign, such as the Council of Europe, the European Institute for Gender Equality, and the Parliament of Catalonia and the Catalonian Ombudsman. So welcome very much. Thank you for joining us, Tanya. So I wanted to talk a little bit about why we're all here tonight, and a little bit about Wen as well. Who's heard of Wen? I know you have to hear of Wen to actually log in and join us here, but yeah, everybody's heard of Wen. Great. Wen's been around since 1989, and our vision is a world where women, communities, and the planet thrive because of values of equity, collaboration, and care underpinning our society. And from our beginnings, we worked on issues where gender and the environment intersect. For example, on air pollution, to food growing, to real nappies work, to toxic chemicals in cosmetics. And our chemicals work is under a vision for a toxic-free future. The environmental campaign, which I work on, aims to raise awareness about toxic chemicals and hidden plastics in many period products and promotes safe, healthy, sustainable and affordable period products for all. We initiated the Environmental Week of Action this week in 2018. We work with a coalition of groups all working on safe and healthy menstruation. And we have a campaign as well, which we will be talking about tonight, looking for a Menstrual Act to promote safe, healthy menstruation. The title of this evening's discussion is, What do periods have to do with health and climate justice? And, you know, people kind of sometimes wonder what periods have to do with the environment. So it's kind of hard to make a leap to climate justice. But also this is intrinsically linked to why we need a Menstrual Health, Dignity and Sustainability Act. I'd like to begin by asking you, what's the difference between a candle, a pencil and a tampon? Does anyone know? Apart from the obvious different usages. A good hint is one of these has prohibited lead content, but all are regulated under the same regulation. And another hint is it's not the tampon. So earlier this year, shockingly, we saw results from a test on tampons that contained trace levels of heavy metals, such as lead, cadmium, arsenic, and mercury. Who knew? But the General Product Safety Regulations prohibit the use of lead wicks in candles, but have no mention of tampons or period products in the regulation. So we have no real way of knowing what's in them, how they're regulated, and we can't choose wisely as consumers because there's nothing on the labels to tell us what's in them. Now, for many metals like lead, there's no safe level of exposure, and the vulva is a very absorbent place. So the health effects associated with exposure to some of these metals include cancer and infertility, and they also, in the case of lead, cause neurological damage and developmental damage to the developing fetus. And this is also combined with some other chemical residues that have been found in many period products, such as biocides, which naturally we talk about, like silver. And these are found in many single-use disposables, but also, sadly, some reusables as well. Now, we think this should be a huge concern. There should be people marching in the streets about this because it's not acceptable, especially because many of the chemicals as well are derived from fossil fuels. And thus they're linked to climate change and thus climate justice. So there, there's linkages all around the houses basically, and there's little or no regulation or transparency about what is in products used by millions of women, girls, and people who menstruate on a monthly basis. And this is why we need a Menstrual Health, Dignity and Sustainability Act, not only in the UK but globally. We believe that menstruation is a human rights, it's a public health, and it's a climate justice issue. Who says they actually agree with this? Let me hear you. Yes? Yes, everybody. So from period equity to environmental impacts of disposable period products through to the health implications of harmful chemicals and metal in period products, both single-use and reusables, the lives of women, girls, and those who menstruate is impacted globally, as well as here in the UK. We need an act because menstruation, we believe, is an intersectional issue. There are so many facets to menstruation, the health impacts, the waste impacts, and also the centuries of stigma and taboos around menstrual blood. And we believe as well that we can't really address period poverty and the lack of education around periods unless we address every aspect of menstruation. We've been told that this Menstrual Act could be very difficult to implement, but we've never been ones to accept no when somebody says it can't be done, because we see it's been done in Catalonia, which is Tanya is going to talk about. In March 23, the government approved a comprehensive menstrual and climateric equity plan spearheaded by the Ministry of Equity, Equality and Feminism with the participation of all departments. So it can be done. It's actually framed under a national strategy and reproductive rights strategy, or a national sexual and reproductive rights strategy. And this should ring some bells when we think about the women's health strategy here. Is this not a place that this work could be done under this premise? We think that women and those who menstruate face so many obstacles in our patriarchal society that menstruation is the underlying factor that makes many women's realities complicated, especially in times of war, displacement, and in every country impacted by climate change, which every country is. And our world is a very turbulent place at the moment for many. We must also remember and acknowledge that. We're going to hear more in a minute from Tanya about the Act. We're going to hear from Natalie about her private members bill. We're going to hear from Karen and her pioneering work on the NHS, and Maria's research on the barriers Gen Z face when making decisions about period management. Our Menstrual Health, Dignity and Sustainability Act has been signed by many organisations supporting the work. But I just wanted to say, somebody said, well, it's our work. Well, it's not our work. It's all our work. We just drew on everybody's work and compiled it all into an act. And we're kind of taking it forward on the journey, which we hope will end up with legislation. And just finally to say, I think we cannot hope to achieve climate justice without addressing the human rights and public health aspects of menstruation. Nor can we hope to overcome the human rights aspects without considering the health and climate justice issues. So thank you very much, and we're going to move on now to hearing from our speakers. So let's begin with Tanya. to kind of set the scene around looking at what an act looks like in when it's up and running. Tanya, if you'd like to introduce your work to us.
Good evening, everyone. Thank you very much, Helen. I'm extremely pleased to be part of this panel and to be able to push this strategy, this act forth, helping you in whatever capacity I can as a former minister and current MP. So as you mentioned, in 2021, the left-wing government of Catalonia created for the first time a Ministry of Equality and Feminisms and adopted an unapologetically feminist agenda. And this ministry drafted the National Strategy for Sexual and Reproductive Rights, founded on the premise that these are human rights. And this strategy introduced the right to menstrual equity, which we define as the egalitarian access to education on our own body and to health with a gender perspective, along with menstrual products, so access to menstrual products, particularly those that are environmentally friendly, meaning reusable and toxic-free. And we adopted a comprehensive menstrual equity and climatic action plan, which includes this global first that distributes free menstrual products in a universal fashion to all girls and women aged 10 to 60, as well as transgender men and non-binary persons who menstruate. So we actually proved that this is a doable action. One reusable menstrual product, either a menstrual cup, a pair of menstrual underwear, or 2 cloth pads, can be collected at any local pharmacy by showing a QR code downloaded from the app of the Catalan health system, covering also undocumented migrants. So here, the intersectional approach. This is the most app used in Catalonia, especially after COVID, where everyone had to make an appointment for the vaccine through the app. Various public information hotlines and public services have been trained in the facts of this action and can also help citizens download the app. Pharmacists are community health agents who people trust, and we train them, we, the Ministry of Equality and Feminism, train them to offer this specialized counseling. Pharmacies also have the advantage of guaranteeing territorial access, because pharmacies can be found in small villages, in big cities, right? So we have 3,000 pharmacies scattered throughout the country participating in this initiative. But we don't buy the products from the pharmacy. We launch a public procurement that includes the 3 types of products. For the menstrual underwear, we cover sizes ranging from XS to 3XL, because we had to take into account the diversity of women's bodies. And we didn't buy 2.5 million products at once, which is the number of girls and women in this 10 to 60 age range, but rather we react on demand. So we source logistics centers that then distribute to pharmacies, but we can monitor whether we are missing or we are getting short of a specific product. So we are not stocking lots of products which would not be environmentally friendly. And we also introduce in this public procurement guarantees that the products, the raw materials through which all the products are made are toxic free, that they respect the human rights in the countries of origin of these products, and also all labor rights guarantees. It also entails that this is proximity production. So we are buying these products from local small or medium-sized businesses based in Catalonia. So we also reduce the pollution generated with high distance transportation. And just to give one data on the impact of the action, within 10 days of the launch, over 250,000 women had already collected their free product. And the social conversation around menstruation had reached TV and radio, political talk shows, social networks, coffee breaks at workplaces, school parent chats. So besides covering the immediate problem of period poverty, this action also steers structural change, because there are no many policies through which you can actually steer conversations that challenge taboos, that open up spaces for conversation that's so long overdue. And by early September, so about half a year after the launching of the action, almost 500,000 women have collected their products. Helen, I don't know if you want me to continue on the Climateric Action Plan here, or do I save it for later? But I want to emphasize that, as you said, furthering gender equality, public health, and climate justice are goals that governments must guarantee. This is the fulfillment of international covenants of women's rights, human rights, and as proven by the Catalan government, a policy that guarantees menstrual equity while caring for the planet is not only doable, but very affordable. So I therefore call on the UK government to adopt an act like the one is putting forth, because there's no excuse. There's no excuse based on budget. There's no excuse based on feasibility. It is actually doable. It's already happening somewhere else.
Thank you so much, Tanya. Yes, I wholeheartedly support your call. And yeah, we will be asking more questions specifically about the Act and how you implement it and why. I suppose we should go to Baroness Natalie Bennett next as the sole spokesperson for the UK government here tonight.
No, I'm definitely not a spokesperson for the UK government. Member of Parliament, yes.
Yeah. If you would like to tell us about the work that you've been doing and how it's related to this Act.
Certainly. Well, I guess I'll start from the fact that you mentioned pesticides, pharmaceuticals and plastics. And that's my kind of shorthand old journalist phrase for way of describing what's known as novel entities, which the Stockholm Resilience Institute has identified 9 planetary boundaries. And you might be able to think immediately about climate and the collapse in biodiversity. Well, novel entities is the fact that we're essentially poisoning this planet with new compounds, new materials that we've created that nature has no way of dealing with. So hence my shorthand, pesticides, pharmaceuticals and plastics. Now, of those 9 planetary boundaries the Stockholm Resilience Centre has identified, we've exceeded 7 of them. And one of the ones we've most exceeded is novel entities. And so what we're essentially doing is living in a poisoned planet. And that is obviously of huge impact for the environment, but also is a huge impact for public health, for human health as well. We are all essentially living in a soup of those compounds. Now, tackling that is a very big issue, and I will just mention plastics, and of course that covers many period products, that we've recently found microplastics, the breakdown products. Plastics just break down, essentially are not changed, they just break down into smaller and smaller pieces. And they found microplastics in breast milk, microplastics in human placentas, microplastics in human testes, and most recently, only a few weeks ago, a significant quantity in human brains. And no one is yet quite sure how it's getting across the blood-brain barrier, or possibly there are other mechanisms. There was actually just today, I tweeted today, a really interesting study looking at water fleas of all things, but they exposed water fleas to PFOS, so those forever chemicals that you've probably heard a lot about, how much of them are in our sewage, in our rivers and seas, and microplastics. And whether you successively expose them to first one, then the other, or both at the same time, in both cases, you saw much bigger health effects from the 2 of them than from one alone. So we're in this toxic soup. And this was my second private member's bill. My first private member's bill was to abolish my own job, to replace the House of Lords with a fully elected House of Lords. You know, democracy, it would be a good idea, wouldn't it? However, I kind of knew that was not immediately going to happen. So this is, the biocides bill is my attempt to actually find a private member's bill that's absolutely deliverable. And the other context for this is, you may know about antimicrobial resistance. So there's just been a UN high-level meeting at the General Assembly. Antimicrobial resistance means that the antibiotics, the antifungal drugs that we rely on for all of our modern medicine, we're losing them because bacteria and fungi, other microbes, are becoming resistant to them. Now, the focus on that, and Dame Sally Davies, a name some people may know, has been an absolute leader in this, has been misuse of pharmaceuticals. I also focus a lot on the misuse in farming, because a huge amount of them are used in factory farming. But also, if you went down to the Tesco Metro down on the corner there and looked at the cosmetics, you will see hand wash and body wash that says antibacterial. There might even be, it does exist, it astonished me, toothpaste that's antibacterial. And there's a mouthwash that uses a compound that has the same mechanism against bacteria as does our last resort antibiotic that we use to treat patients when every other antibiotic has failed. And none of those things need to be there. One, because they're inducing resistance. What happens to all those things? Ultimately, they get washed down the sink into that soup of plastics and PFOSs and all the other chemicals. And they're actively harmful. There's a new word, this was only published in the scientific literature last year, and unfortunately it's a bit of a mouthful, microbiotoxicity. I'm going to call it MBT because that's a lot easier to say. But you probably know that you've got a microbiome. We've had a lot of focus on the gut microbiome. We also have a skin microbiome. We also have a vaginal microbiome. You have a lung microbiome, and how you reacted to COVID has something to do with your lung microbiome as well. And microbiotoxicity, MBT, means you're putting something antibacterial on part of your own body, yourself, your bacterial load that's good bacteria. You're killing off your good bacteria that you need for health with these products. And the thing is, if you could say, take the hand wash, there was a study done in a South Asian refugee camp comparing soap and water and antibacterial hand wash. The soap and water was just as good in an environment that's as challenging as you could possibly imagine. Essentially, it's mostly the mechanical action of washing your hands that does most to get rid of the bad bacteria that you may need to get off your hands and off other parts of your body. And then the one final thing which really particularly ties us in today is there's something called, the third part of my bill looks at treated fabrics. And here we're talking particularly about reusable menstrual products, which often are treated with nanosilver, which is an antibacterial. You can also get socks with it. Now, there's actually work being done in the US that showed this is bad for your vaginal microbiome, unsurprisingly. There's also the fact, when you look at the environmental health aspect, that after 7 washes, most of it's gone. It's gone down the sink. One more thing to produce resistant bacteria down there in the sink. So it's bad for our own health, human health. It's bad for the environment. It threatens the things we need to keep us safe. And sorry, I can go on for this forever, but I will just do one final point, which is, what does resistance mean? Well, in South Africa, there was a lab that had this real problem with E. coli that they just couldn't get rid of. And they could not work out where this E. coli, this dangerous bacteria was coming from. And they eventually found that it was living in the bottle of antiseptic. It had got so resistant, it was actually feeding off the thing that was supposed to kill us. And so I picked the biocides bill and cosmetics products, and it's focused quite narrowly on human products, because veterinary products is a whole nother issue that brings up a whole nother can of worms. So I picked something that said, we just do not need these products here. And it's also quite revolutionary because there's usually a problem with these things. For example, the Americans have actually banned a couple of key chemicals from hand washers that you're still allowed to put into hand wash in the UK. But you've got the whack-a-mole problem, as it's known as, which is very often the companies will replace that one chemical you didn't want with another chemical that's even worse. So my biocides bill takes what I think is probably in global terms a novel approach and says, okay, you can't put any biocide into any of these products unless you can actually demonstrate to a committee of experts that there is a good reason for this and it significantly improves and it doesn't cause too much damage. So rather than playing whack-a-mole and banning this compound and then they bring in that compound and banning that compound, it says none of these unless you can show there's a really good reason for it. And, you know, take that mouthwash, for example. At the moment, you can just walk into the chemist, walk into the Tesco and pick it off the shelf. It may be that if you walk up to the chemist and say, oh, I've got an abscess in my mouth, you may need that mouthwash. But it should only be used when necessary. It's about reducing the load and using it for good purposes and protecting all of our microbiomes at the same time.
Thank you very much, Natalie. And that was very... There are some more specific questions about your bill, so we will get back. But yeah, a lot of food for thought there, I think. And I'd like to come to Karen next. And from your work in the NHS and with obstetricians and gynecologists and healthcare, what's your take on this?
Yeah, so it's a really wonderful take, I think, a whole journey of discovery. So when we think about periods and we think about climate, we always think about actually just the trees. And we think a lot about the world dying. But the one thing I always say is that the people will die before the world dies. And the reason I say that in particular is because of the work that I started to do with global maternal health, which looked at air pollution. So I thought I was on a journey of looking at the lungs and thinking how did that affect women in pregnancy and babies. But what we started to realize is that it's not just about the air, it's about your food, it's about your water, it's about your environment, it's what we are growing our bodies in, which is what we're growing the future human race in. A discovery happened probably a few years ago in Imperial, where they recognized that the placenta that we thought was this wonderful organ that used to filter all the things that we didn't get through to the placenta had everything in it. It had microplastics, it had all these PVCs, all these chemicals that we really, really didn't think were getting across the baby. We thought it was a guardian. So then we started to look further at these chemicals and we realized they were causing something called epigenetic transformation. So then that brings me back to the story of the Black woman. So people often, it's becoming like one of those things, I want to talk about Black health again. Everybody's getting a bit bored about it. But what we realized that because of that intersectionality of being Black and having the gender and sometimes the social determinants of health, that leads us to have more discoveries. So when we were looking at Black women and we realized actually there's an increased risk of stillbirth, miscarriage, growth restriction, type 2 diabetes or gestational diabetes, the list goes on, including autism, we could link it back to these epigenetic transformations that were occurring at the level of the placenta. And we just thought, oh my gosh, wow. So before the planet dies, the people are starting to transform and they are having diseases which are linked into the future generation. Because epigenetic means it's not just in that woman, it means that you've got this pool of genes that have all these signals. The signals either tell them to live for health or to develop disease. And these signals are being passed down to our babies and our future generation. So then when we look at periods, I, as an obstetrician and gynecologist, love delivering babies. And when you deliver babies, everybody knows, I think the vagina is one of the best organs in the whole body. It's one of the most vascular. It has great ability to heal. But in being one of the most vascular, it absorbs everything. It absorbs all the things that we put in there. We put in medicines within the vagina, on the vulva, and then to learn from this year that period products contains all the things that even we don't want to have in our shampoos anymore. And we're inserting that into vaginas that are going into our reproductive organs. Imagine the destruction that that is causing. imagine how those particular chemicals are changing the microbiome as we described, causing endocrine disruptors, leading to probably things like polyps, fibroids, all these conditions that we are sitting here thinking, why are they there? So for me, when you look at period justice, it links completely into climate health. It links into all the things that are now getting into the things that women are putting into their bodies, they do not have the knowledge about that. Take that back one step. When I think about my colleagues, that I posted this onto the WhatsApp chat to the consultants, and they were not even aware of this. So even as doctors, we're not fully aware of the damage that sometimes are being caused by these things that are available to women that we are busy trying to treat. So I will say that this bill is a wonderful bill. So proud to be involved in Wen. And for me, I think it's one of the foundations. We can't keep putting sticky plasters on at the other end. We have to get to the foundation of the problem and sort out the root of the problem before we can address all our menstrual health. Thank you.
Thank you so much. I wish everybody in the NHS thought like you. I think it would benefit us all, and we're going to be talking to you about how we might persuade them to think like that as well. I'm sure you spent a lot of time doing that. But I suppose for me, it comes back to education. Like you said, it comes back to education. That's where I'd like to talk to Maria about her work on education around menstruation, because it starts in school. So off you go.
Absolutely. Thank you so much for inviting me to speak here today. It's such an honour to be on this panel, and also it's so fantastic to be here supporting an act that's going to really hope to make a huge difference to young people. So I've done research with teenagers in schools across Yorkshire, and also menstrual activists as well. So I spoke to 16 to 19-year-olds about their views of menstruation, what they learned from social media and news media about menstruation and related topics. And I also spoke to them really specifically about climate justice and climate change regarding kind of menstrual products. So I spoke to 16 to 19-year-olds, I spoke to girls and non-binary students, but also boys as well, who are often kind of left out of these conversations. And we're very pleased to be included. So we looked at lots of different topics. All of these intersect with sustainability. So we spoke about period poverty, we spoke about menstrual stigma, we spoke about education in schools, we spoke about the experiences of trans and non-binary people who menstruate, and we spoke about period products. And most of the young people I spoke to, so 77 teenagers, had heard that disposable period products were bad for the environment. They were fully aware of that. Most of them were really concerned about the impact of period products on the environment. Even some of the boys were aware of this as well. One boy, for example, said that he'd watched David Attenborough talking about products washing up on beaches, and he was aware of that. So even though they were already aware of the negative impact of period products on climate change, very few of them had actually tried sustainable products. Most of them had heard about them, but very few had tried them. So I kind of asked them as to why. And those who hadn't tried reusable products, such as cups and pants and reusable pads, gave a few reasons for that. So one of the main barriers was financial. So even the schools I went to where they had free period products, most of them were single use rather than reusable. So most said, well, I can't afford it, and I don't want to spend money on a product that I don't know how to use or I might not like using. Others said it was very specifically around the stigma of touching menstrual blood, that they didn't feel comfortable having to empty a cup out or wash a pair of pants. And others said very specifically it was the facilities in school that put them off. So most of the young people I spoke to said they didn't have a sink within a cubicle, and if they had that, they were far more likely to use menstrual cups. So that was one thing, or pants as well. And another reason, and this links back to education again, that they were wary of using reusable products is they weren't sure how absorbent they are. And most of them had only had lessons about disposable products. So something people said, well, if I actually knew how long I could wear a period pants for, or how long I could use a cup for, and I knew they weren't going to leak, I'd be more likely to use them. So I've actually done some work around this. I've worked with a fantastic performer and teacher down at a school in Brighton, and we actually taught some year 5 and year 6s about periods, and one lesson was about the reusable products. And because we combined it with a science lesson, they got to test the absorbency of the products. It really encouraged them to try them, and the school provided free reusables, which schools can because they are part of the government period product scheme. So they are available now, which is great. But I think more schools need to be aware that they're available, and they need to make sure they're accessible. Some of the young people told me that products were hidden away in store cupboards, they weren't accessible between classes. That's another issue. So definitely accessibility is key. But certainly young people are far more aware now, not only of the negative climate impact of single-use products, but also of the existence of harmful chemicals in products as well.
Thank you so much, Maria. And we're going to be talking more to Maria about this work, because we're going to be doing more education with young people around menstrual products as well. But it's amazing. It's great to hear that the awareness is growing as well among young people. And, you know, if we can address some of the barriers to them using the products, that would be really something. And I suppose because we do include in the Act, you know, kind of targets around education, but I suppose for us, we're trying to look where the starting point is for bringing in this kind of regulation. And I'd like to go kind of back to Tanya, really, and ask what the starting point for the Catalonia National Strategy for Reproductive Rights and Menstrual and Climatical Action Plan was. And I suppose the kind of follow-up question is how did you begin this process of taking this from a need to a government plan? And just to explain a bit about what the plan covers as well, for those who don't know.
Yes, thank you. So we collected data through a Catalan-wide public survey to challenge some preconceptions and myths about the reality of menstrual poverty, right? And we found out that 23% of women cannot afford to buy menstrual products, and 44% opt for products that are not their first choice due to economic reasons. And this has a strong impact on women's health, because they are using instead non-adequate products such as toilet paper, diapers, towels. We also found out, as Maria was now saying, that there was a great lack of knowledge on reusable menstrual products. So the policy had to tackle not just menstrual poverty as such, which is a social justice issue, but also to make it available to everyone. It had to be a universal policy so that all women would be encouraged to try these products because they would be free, available in every single pharmacy of the country, right? And they would have this counseling provided by the pharmacies in terms of, yeah, what's the absorption capacity, how long can I use it, blah, blah, blah. Also in terms of the taboos and myths surrounding menstruation, 12.6% of women did not know what menstruation was before their first period, and 40% still now provide incorrect answers to the question, what is the menstrual cycle? The incorrect answers for men amounts to 52%. I mean, this is a serious public health issue, right? 7.9% consider pain to be a normal symptom. And this might delay the diagnosis of endometriosis, lead to strong pain, to fertility. So, and besides the generation of about 9,000 tons of waste out of single-use products per year in Catalonia. So we launched this redistribution, but at the same time, we wanted the plan to be comprehensive. As I mentioned, it's not just the menstruation, but it's also the climacteric. So we are covering all phases in women's lives. Also to sensitize that these are not pathologies. This is just phases in our lives, and that we need to learn, get more information about how we can live it with dignity, with free choice, with information. So a second block of measures in the action plan, besides, as I said, the free distribution to facilitate access to products, is to promote a positive menstrual and climacteric culture, which includes menstrual and climacteric education provided in education centers, community centers, other public services, and also it's also to be introduced in the training of professionals working in the fields of education, youth, health, community action, sports. We'd also like information of what's best for women when we menstruate or when we are in the premenopause or postmenopause periods, right? So we need professionals to be trained in that. The third goal of the plan is to guarantee equity at work with gender-sensitive occupational health measures. So we adopted for the civil servants, because that's the competency we have as a government. For the private sector, the regulation can only be passed by the central government, by the Madrid government, so to say. So for civil servants, we introduced a recoverable 8-hour flexibility scheme per month to address the health and well-being challenges associated with menstruation or menopause, because these are not pathologies. For acute dysmenorrheas, that would be like a sick leave, remunerated sick leave. But what about the days we have this strong insomnia and we can actually go to work, but we won't be productive, our well-being is impaired, but not necessarily permanently. So this flexibility allows for taking into account that if our bodies are not the same on every single day of the month, why are we expected to work as always every single day of the month, right? And lastly, the plan aims at promoting research on menstrual and climacteric health and on the ecological impact of single-use menstrual products. So these are about 60 measures, 60 actions in the plan. As said, it encompasses actions that engage the 14 ministries. That was the previous cabinet, but it has actions for the different ministries, also NGOs, community agents, because this is a policy that needs to be guaranteed by a whole community, right? Especially if we are to break taboos, to secure access to information, and then to strengthen the knowledge on our own body and our free choices. Also very important, that just last point, yeah. Intersectionality, as has been mentioned, for example, the free distribution of reusable products through pharmacies won't work for female inmates in prisons or juvenile detention centers. So in these cases, we have provided specific training sessions and distributed to them a kit with these free products. So a cup, a pair of underwear, and 2 cloth pads, and also I might not know the word now in English, but you know this recipient in which you can hygienize the menstrual cup in a microwaves, because they do not have access to a boiling. They cannot boil the menstrual cup to hygienize it.
Yeah, a little pod.
Yes, exactly.
Pod, yeah.
Yes. But they have access to microwaves. And we have also developed specific actions for women with disabilities, also with migrant women, because in some countries, taboos are found in every single country. But in some countries, the taboos might be stronger or might be specific, so that working with NGOs from these communities or community organizations from these very same communities, we can more easily work on all these taboos and adjust the action and sensitization and training to the specific needs.
Thank you very much. That sounds amazing. So I suppose I'm going to ask Karen, from your vast experience in working in the NHS and shaping obstetrics and gynecological policy in Wales, do you think we might be able to do something similar here?
Most definitely. I mean, I bow to everything that Tanya's done in Catalonia. It's absolutely fantastic, and she's laid out the perfect blueprint. What I will say for us as a country, we often love, that urgent thing that makes us think again. We like to have a call to action in the sense that we're recognizing something is urgent and acute in a different way. And when it comes to climate, I think the one thing that would help to drive policy a little bit further is to understand the basic research and to understand the figures which are impacting us here and now. And particularly when it comes to menstruation. Menstruation is a sign of health within a society. And we know that our fertility rates are declining from male and also female, and that we need to improve it. We also know that the chemicals are a direct impact on menstrual health. And we also know that the chemicals are not improving, they're getting worse. When it comes to policy, another thing that I would consider would be a call to action is thinking about what Tanya said, is about the amount and tons of waste. Because the government always likes to think about something that's not going to cost them money or maybe be cost neutral. So a way to really implement the policy from a governmental perspective would be in that level. But when it comes to the actual NHS and health, it's often that research that tells us that the people that we're treating require a different way, otherwise the treatment's getting worse. And there are different bodies that we can use. There's the RCOG already. They've issued that impact statement looking at pregnancy, and we're hoping that they will also issue an impact statement looking at gynaecology. It needs to go into women's health strategy as well, but we definitely 100% need it in the UK, and I think that you would all agree. Yeah?
Thank you very much. Yes, absolutely agree. And I suppose, do you think the NHS is aware of the potential harm from toxic chemicals?
I don't think the NHS is aware. So that's some of the work, as you know, that we have been doing and linking up actually from the aspects of looking at the impacts on children. It's then causing us to look at gynaecology. So we're linking up with different healthcare professionals at the moment within London to develop educational resources that then can be used for people within the NHS to counsel people. But you must, I mean, obviously you realise when we go to medical school, it's not always that comprehensive, the curriculum isn't. And unfortunately, it's not great when it comes to environmental aspects. So us within the London School of Obstetrics and Gynaecology, our next strategy is to really look at the next sort of year and how we implement like public health in particular into that curriculum. And then we're going to use that as a model to take across to other schools across the whole of the UK. And when we talk about schools, that's postgraduate education and training in obstetrics and gynaecology. So that's what we're going to be doing over the next year.
Wonderful. We would very much like to be involved in that. I'm sure lots of groups in this room would be as well. I think I was going to ask you about the effects of myositis and periprosthesis. I think you've already answered that. But I was wondering, because at the start of your new book, Change Everything, How We Can Rethink, Repair and Rebuild Society, you actually question what is viewed as common sense and also the role of feminism in bringing about change. So I'm asking you as a feminist since the age of 5, what role do you think feminism has in changing everything?
Oh, that's such a big question. Although I do just actually want to address the NHS point and say that I have encountered in the NHS some people doing amazing environmental things. And I'll mention Richard Hickson, who's a consultant A&E doctor, who is working very hard to reduce the plastic use in A&E. And I went and he showed me they set out 1 day's use of plastic for a typical A&E patient at acute care for 24 hours, and it's enormous. And it's a wonderfully illustrative example of that if you can switch from IV antibiotics to oral antibiotics, it's actually better for the patient and it produces far less plastics. So there are people in the NHS working terribly hard on this and really seeing the intersectional issues. And visiting Darlington Hospital, they were acutely aware of the public health aspects, serving a very disadvantaged community, of what they did in the hospital had impacts on people's health and whether they were likely to end up in the hospital. And it's a very circular thing. But in terms of the feminism point, I actually credit Wen. It was actually at a Wen event that I suddenly really realised the way in which feminism and environmentalism line up together, because both people working in both areas, we've spent years, decades, I was feeling very old when you were talking about me in Thailand in the 1990s, when lots of people in this room probably weren't born, or just barely, but we go and fight this battle and we go and fight that battle, and we win and we get some more women on the board of something, But if you don't have a rule and keep the rule that says there'll be a minimum number of women, as soon as you take your attention off that and go and look at something else, they fall backwards. It's kind of a variation of the whack-a-mole problem. And, you know, I've marched down many of a road chanting system change, not climate change. And what really ties feminism and environmentalism together is that this system is built against the environment and is built against women and girls and non-binary people. And we have to change the system as well as, you know, tackle the individual issues when you can, but understand fundamentally that need for system change. And just, thank you. And just tying this back to biocides and what we're talking about now, and we're thinking about period products and, you know, the horrendous phrase, the adverts, combats menstrual odour. There is no such thing. Advertisers invent things for us to worry about so that they can then sell us things and tell us we should spend more money on their things than someone else's things because of this thing they've just invented. And this is as true as biocides in toothpaste or hand wash as it is in the menstrual products. And, you know, behind that is this idea of we're told competition is such a wonderful thing. Competition gives us good things. People are competing and advertising to poison us and rip us off. That's the system.
That's a very good quote. We'll have that. Thank you. I suppose it comes back to these kind of decades-old kind of stigma and taboos around menstruation. And you suggest in your upcoming book that menstruation is shifting from a very private experience to a collective one. So how can we facilitate this shift, especially in relation to deconstructing these stigma and taboos?
Yeah, excellent question. When I knew that I was going into schools to speak to teenagers about periods, I was very interested to see how they would respond, whether there would be a lot of awkwardness in the focus groups, particularly as I had quite a few mixed gender focus groups where boys and girls were expected to sit together, talk about periods. And I wanted to see how that would go. What really surprised me about the teenagers I spoke to were how confident they were to talk about periods. I wasn't expecting this at all. And a lot of it was down to social media. The fact that all the girls and non-binary students there saw periods on social media quite often, influencers talking about them. Some of them followed feminist social media accounts that would post messages about periods. Some would post messages about climate change as well. And even the boys, some of them had seen periods mentioned in other contexts. One of them remembered seeing Russell Howard talking about period poverty on social media. So periods have become part of their everyday lives and communication. About a third of the young people I spoke to said they'd had mixed gender conversations about periods in schools. So some girls said that they just openly talked about periods in front of boys with the hope that it would normalize it. And there were girls talking about their efforts to talk to their dads about periods as well. So that was really great to see. And because of the kind of ubiquity of social media in everyone's lives, for the young people, activism wasn't just a big march or big acts of activism, presenting them to Parliament. For them, even the small act of a social media post where you talk about periods was activism. So for them, that was kind of a small way in which they could make a difference. And because of social media, they began to see periods as a political and social issue, and one which they could talk about together and reduce the stigma together. And interestingly enough, some of the boys I spoke to, they said that, very rarely periods came up on their social media, but they would come up sometimes, usually by stigmatizing content like period memes. That goes back to what we were saying about stigma before. But they were very, very keen to learn. They really wanted to learn, but they felt a bit embarrassed to ask questions. They were worried about accidentally causing offence. And because their education hadn't included them, then they were in a situation where they just hadn't really spoken about it. So that's really important, stigma-wise, to make sure that everyone is included in these conversations. And that could be at school, that could be in workplaces. You know, as part of my work with the British Standards Institute, we've suggested that, you know, sometimes obviously it can be difficult for men to talk about periods, but if you, and as my research shows, you frame it in a context that's relevant to them, then it makes it easier to talk about. So the boys that were the most confident to talk about periods said, oh, a comedian I'd listened to had spoken about it, or I'd seen it in a meme, or I'd seen it mentioned in a kind of political perspective. So I think that's a really good way to kind of break down those barriers. For example, if there's an event about mental health, bring periods into that. If there's an event about climate change, bring periods into that.
It's relevant to everything, and we should be reaching out to boys and men and everybody about periods, I think. And I suppose my question to Tanya really is, how much influence does gender have when formulating policies and regulations around menstruation, given it affects half the global population and women and those who menstruate? So how often is gender discussed in Catalonian Parliament?
Yeah, it has a tremendous impact because gender underpins poverty, social roles, as well as biases and blatant deficits in policy making and regulations. And we can provide a few examples. So menstruation entails an extra cost every month for about 40 years of our lives. And given that poverty is feminized, this is particularly bothersome for women with socioeconomic deprivation, as I said, who might use alternative, non-adequate options, putting their health at risk, but also jeopardizing day-to-day well-being, leading to school and work absenteeism when we don't have access to these products, reduction in the practice of sports and leisure activities or lack thereof. So it has tremendous consequences on public participation as well. You have already mentioned in the panel the insufficient menstrual education, how it perpetuates social taboos, stigmas, myths that are also very harmful for our health, because we are not going to go to the doctor maybe to check whether we might have endometriosis or other things that might be treated, or if treated early, can have very different consequences. This also builds on a historic lack of research on women's health, and there's so many biases on the diagnosis and treatments, right? And also lack of research on the adequacy of non-traditional reusable products, as recent research, as you have been doing, right? Proving that they are full of toxics. And well, we already know quite a few years ago that there are lots of women that get allergies, is that the word? That are allergic to the traditional pads or tampons. Yes. And do we remember that it was only last year that real menstrual blood was used to test the absorbency capacity of tampons and pads? I cannot imagine, if men menstruated, the cost of the menstrual products won't be assumed by the state. I cannot imagine that if men menstruated, toxic products, toxic components would be used to produce menstrual products. So let's be clear, gender blind policies and regulations are just simply bad policy making with tremendous, terrible consequences for half the population. And it fails to guarantee, they fail to guarantee women's sexual and reproductive rights. So it has to stop.
Definitely, yes. Thank you. I think we need to bring in intersectionality as well into this. It's not just about gender, it's about the kind of intersectional nature of menstruation. And Karen, you talked recently about the extra challenges that Black women face when menstruating. I just wondered, in your opinion, what needs to be done to ensure that any strategies and policies recognises these challenges and the intersectional nature of menstruation is actually addressed going forward?
No, thank you. I mean, so first of all, just to outline it, when you think about health equity, it's a human right. You know, why should there be different access to resources, different treatment according to your health? We should all have access to health equity. When it comes to Black women, there's been lots that's been highlighted around maternity, but many people don't realise that actually there's a lot of menstrual inequity. One such example is the fact that many Black girls will start menstruation at least probably a year earlier, or maybe even 2 years earlier than their counterparts, which then mean that when you're thinking about the educational context, if the right strategies and policies are not in place, they will be seen as more absenteeism. They may be in class with, experiencing more sort of period pain without access to pain relief or access to the right period products. They may not come to school at all. So imagine how that affects them when we think about the social determinants of health. And then we move on to later years. We know that fibroids are more prominent in Black women, and that's frequently publicised, and also in women of South Asian origin as well. And therefore that is more likely to lead to menorrhagia, which is heavy periods. So flooding and clots, pain, anemia, which leads to tiredness, affects cognition, IQ. Just imagine from school all the way through work life, how that can lead to differential attainment. So we really need policies that can protect women in the workplace as well as at school, and also consider when they're diagnosed with these conditions, it's classified as a chronic or as a disability, such that they have access to those resources within the workplace or within school as well. And then we think about other things such as endometriosis. So maybe where the diagnosis isn't of a higher level, but because of the fact that these women are Black or from brown or ethnically diverse communities, they have a delayed diagnosis. So where people are getting support and help from that health condition, unfortunately they're not. So the strategies really need to address how we educate our doctors, also think about gatekeeper access to the right resources such as scans to be able to diagnose this. So, unfortunately there's a lot of intersection. And it's not simply about putting it into the lives of broken Black bodies. The other intersection that I will make you very much aware of is the environmental impacts of the vaginal microbiome, as you quite rightly gave talk to, which then affects the way that people classify how they smell. So that we know that in Black communities that are unfortunately more likely to live within towns and cities, where they have more environmental pollutants, which we know directly impact the microbiome. Everybody's talking about the gut microbiome a lot. I love talking about the vaginal microbiome, which then inadvertently also can affect periods, conditions, as well as infections such as bacterial vaginosis, where people think they smell. So then we'll buy products that to continually wash with, or won't want to go to school or to the workplace because they think they have an odor when they don't actually have an odor. So we need the right strategies and policies, otherwise, unfortunately, women are disproportionately affected from these communities.
Thank you very much. I think we do kind of try and promote it around the odour, especially as Natalie was saying, this menstrual odour is a construct, so they can sell us products to get rid of it. And nobody's going to ask the question, does my vagina smell? Because nobody's going to be able to answer that really. And yeah, there's a lot of misinformation out there as well, I think. I'm just conscious of time, and I think it would be really good to get some audience questions. But I would like to give you just 5 minutes to turn to the person next to you and say hi, introduce yourself. Not if you're married to them, sorry, Sashan, the other person. And say hi, who you are, and just think of a couple of questions that you'd like to address to the panel and give them a little breath to take some water.
I've already got a couple of written messages to the government written down from the
I have to give this hello. Okay. We're going to take some questions now. If you've got a question for a particular panel member, please just address that. Zarina has the microphone there. I have a microphone here. So yeah.
Hello. I think it's correct that a third of women have bladder leaks. And so what I wanted to ask was, I mean, in the case of bladder leaks, that's unlike periods, that's something that it would be better for the environment if they kind of didn't happen. So how can we help women not to have so many bladder leaks when it's happening on such a wide scale?
Oh my gosh, that's another area I love talking about, is the bladder in women. So yeah, so I actually helped to set up some of the first what we call PPHS clinic, pelvic health after childbirth clinics across the UK. So I set up one of the sort of initial sites, and that helps to support women in the year after childbirth. Because what a lot of people don't realise is actually, sorry, to you who haven't had babies yet, antenatal pelvic floor exercises are the best protector against urinary dysfunction in later life. Is that a physio or a midwife? And so I'm always telling people, squeeze away all the time. But also, if there is any birth trauma, we need to have the setup, which is not always there across the NHS, to deal with the trauma afterwards. Yeah, so that's the physical side of it. The other side of it is recognizing why have we got the inflammation. So I'm sorry to go back to this, and I know you and I, we keep going back to this. There is a bladder microbiome. So there's a way in which the bacteria sometimes integrate into the bladder wall to cause irritation, so that people have frequency as well, so running to the toilet. And there are ways that you can address that through reduction in inflammation, but also thinking about environmental factors such as pollution, water, food, that also impact in our urinary health. But there's lots of things that we can do. And in addition, as you quite rightly brought up, women use protection for bladder leakage. And so making sure that we haven't got protection that has these nasty chemicals in this toxic pool that we're sitting in, is another really key part of the puzzle.
Great, thank you very much. Yeah, we just did a briefing called No Laughing Matter about stress incontinence, and it was horrific to see what was in the the products used, and again they need regulating as well, but it's a different kind of regulation. But again, and it's a taboo subject that needs talking about and airing as well, because it affects so many women and men and other people as well. We need to really bring it out in the open. So thank you for your question. So any other questions? Yes, this man down here. Oh, sorry. There's somebody else. Sorry. Yes, yeah. That's not him.
Sorry, thank you so much for this lovely evening and informative session webinar that you've, seminar that you've conducted. One of my question is again with Dr. Karen, if you can, I'm not too sure if you have the answer, but it's something like, we probably need to actually look into more. You mentioned about we have so many chemicals, lead, very harmful chemicals in all these menstruation product that has affected women, and it goes into the brain, it goes into the placenta, and everything. Has there been any link to again, like changes in the genetics of children? Because I know you mentioned about autism, but then again, also to do infertility in women. So that's something that I would like to know.
Unfortunately, yes. It's actually pretty serious. We sit here and we're talking about it, and I think it's for us, here to really, really spread the word for people to understand. So autism, definitely. So we all have a set of genes, and people think about nature versus nurture. But actually, it's your very nature of your genes that's nurtured by your environment, and that switches on different genes. So there's been clear studies, I think it was done in the last year, that came out showing that autism is implicated by the environment through clear actions of the chemicals on certain pathways that also change the size of, like the hippocampus in the brain, which is linked into cognitive and neurodiversity. And it's not just autism. There's dyslexia, there's other things as well, and I know that you'll come in and talk about the brain microplastics and the other things that we've seen. So yes, and when we look at fertility, when I was in medical school in the 90s, it was primarily women. So the other unforgotten thing, which I think maybe will get people to think a bit more, because men always care about their reproductive organs, is that male fertility has shot up. It's been like year on year, it's been declining, such that it was probably only 10% of couples when I initially started in the 90s, but now it's 50%. That is a massive, massive change. And that is related to genetic changes, which are going down through the woman to the baby, which are being passed on generation upon generation upon generation. I think you wanted to add something.
Well, I just wanted to add something, because it's something I spent a lot of time trying to explain to the House of Lords, and I haven't got it through yet, but I'm going to try. I'm sure this audience will get it. And I think you've already said this, Karen, but I think it's really worth stressing. Most of us have been taught in our science lessons that the genome, the genes, are a blueprint, like a machine blueprint, and that determines how your body comes out. Now, you used the word, Karen, epigenetics. And what really the discoveries in science, particularly in the last 20 years, is we now understand that genes, there's lots of different ways that genes can be expressed, and lots of those things can also be inherited. So it's not necessarily the case that a gene has been absolutely changed by this environmental exposure. It's the way the gene works that's changed by the exposure. So it's a much more subtle thing, and we still don't really, I think we fairly say, understand how many of these things work at all. And we also know that these goes down through 2 or 3 generations. So, you might be told, oh, it's all right, don't worry, we've done the tests and it's not causing any mutation of the genes. But it's actually much more complicated than that. And that's something we've really only come to understand recently. And whatever people are stuck on that idea of it's just like a machine blueprint, our bodies work like machines. No, they don't. They're biological. They're really, really complicated.
And then a perfect example of that, it will be like Alzheimer's and dementia, where only 3% is genetic. Imagine that. All the other causes where we think it's passed down. Oh, your mum had it, so you might have it. Environmental, lifestyle, those are all the things that can alter your outcome. The same, I will say again, anybody who's here from a community, South Asian and Black community, I get fed up with hearing about gestational diabetes. Oh yeah, South Asian community. There are clear lifestyle, environmental, protective things that you can do to reduce that being passed down to the baby in the future generation, or to prevent it happening in the pregnancy, but we are not telling you about this enough.
I suppose, I mean, yeah, I would probably be a question from some of the groups working on chemicals and endocrine disrupting chemicals, and why the government isn't legislating on these really, really quickly, because they're implicated in so many diseases, illnesses, and especially pre-birth exposure, really serious. I was wondering, Tanya, did you have any discussions around chemicals and period products when you were thinking about what products to provide? Did chemicals figure at all?
We included it in the conversation of the 3 goals of the action, which was said social justice, gender justice, as well as climate justice. And there's a strong intersection here between gender justice and climate justice. And as also mentioned, we included in the public procurement that the products had to be certified as toxic-free and as well as respectful with human rights in the countries of origin where the raw materials are produced. So all components of the chain production have to respect labor rights, human rights, and be toxic-free. But the debate, have to admit, in Catalonia was not so much on the chemical components, but rather on the new right that had to be guaranteed and be universal. Because we cannot fight climate justice if it's a means-tested benefit or it only addresses socioeconomic needs. The same with social taboos and stigma. For the conversation to be really wide in society, to engage everyone, we need to make the products available to everyone and to have this sensitizing and informative actions in as many places as possible.
Okay, and I was wondering, Maria, because you said as well that Gen Z is becoming increasingly aware of toxic chemicals. Where are they getting this information from? Hopefully from us, but probably not.
Yeah, potentially partly, but actually it's pretty much from social media. That's where they're generally learning about menstruation and its kind of intersection with climate justice. But I wanted to build on a point that we've all been discussing around intersectionality and how the role that plays in education. So some of the young people that I spoke to were from kind of lower socioeconomic backgrounds, but also some of the young people I spoke to were people of colour, of faith, and of all the different intersections and groups that I spoke to, they felt the most marginalised from mainstream menstrual education. I mean, all the young people I spoke to said that it wasn't good enough, primarily because it hadn't taught them what symptoms were normal, what level of pain was typical or atypical. But specifically, the young people of colour, of faith said that either they just felt that the education was not inclusive to them. And this is why it's work by organisations like Diversity in Sheffield and Sisters, who are a fantastic, like, woman of colour-led organisation, are so important, because these groups are forgotten from these conversations. And as well, the fact that some of the young Muslim girls I spoke to had heard of menstrual cups, but they hadn't heard of external reusables. And they were saying, well, if they actually had known that there was external reusables that they could use, then they would actually have started to use them and tried them. So they felt like the vast majority, the young people felt like the vast majority of external menstrual products that they saw that were reusable were internal. So actually quite a few of them thought they were only internal reusable products. Yeah, so that was quite a big issue.
Lack of education and kind of, I mean, I suppose when we were doing workshops as well, we train environmental ambassadors and we train teachers, university students, parents, but we provide a toolkit with examples of all the products, and we go through a demonstration of how you use them all, because we've had some seriously strange questions about how people think products are used over the years.
Yeah.
And yeah,
absolutely,
I think it's important to get it right.
And as my research showed, just seeing a video on social media on how to use a cup or what period pants the absorbency period pads isn't enough. What the young people really wanted was tactile engagement with those products, to know how to use them and to be kind of less wary of them.
Yeah, somebody said they were asked by some man that had probably gone through his whole life and thought that a tampon was put between the lips of the labia. But, you know, he probably was so embarrassed to ask, and he probably, you know, so yeah, it's really important, I think, to kind of get this information out there and tell people. Another question, anybody? Sorry, the person, down there, had your hand up a while ago, yeah.
Actually, thank you so much for answering the question. My name's Olivia, and I'm from Leaders in Community based in Tower Hamlets, and I brought some young women with me today, and they had a question about the point that you literally just answered for us. So thank you. It was just about the pain that a lot of people experience during a period pain, but in particularly Black and Asian families, how that pain is almost normalized, like, oh, okay, Mom, I'm on my period. Oh, okay, that means, you know, Mom, I'm feeling pain. Okay, you're on your period. That's why. But it's like, actually, if I knew that I could access a product that would reduce the pain that I feel, that is, you know, good for my body, Mom, how can I teach you about that? Do you understand my point? So it's about how you also teach the families of these Black and Asian young people. But you've all answered really well. So if you want to expand, you can. But yeah, that came from a young person from our group. Thank you.
Does anybody want to ask that question or a follow-up question from the group? No? No.
That's incredible to hear. Thank you so much for sharing that. And that's exactly what was coming out of the focus groups. One of the things I've done since to kind of address that is that in the menstrual education curriculum we did in the primary school, we actually included some of the quotes from the focus groups where some of the young people were sharing their experiences of period pain. And we used like stock photos, not obviously the pictures of the actual participants, but for the young people I spoke to, they actually said, first of all, they felt like the examples they were given at school weren't very diverse. So in the curriculum, we included like diverse examples of people from different backgrounds with those quotes. And it just kind of really brought it to life for the young people, what period pain feels like, and generally gave the guidance of, so they had these scenarios, they had to say kind of what level of pain medication they would give, or how they would treat that pain. Is it just bad enough that it just needs a hot water bottle? One of the scenarios was the pain is so bad that I can't get out of bed and go to school. And the young people, the children, their job was to advise, oh, maybe you should talk to a doctor. But so again, in the research the teenagers spoke to, many of them didn't realise that if your pain is so bad that you can't get out of bed, then that's an issue. So one of the young girls I spoke to, she was talking about how some days she couldn't go into school because her period pain was that bad. And she actually hadn't realised that wasn't normal.
So the other thing I'll add into that, so thank you so much, is that for people to realise that because of structural racism in some Black and brown communities, the mistrust of the health system is quite profound. That's one. It then links into actually people within these communities, because they often come from systems where healthcare is not free. The first way in which to deal with health problems is to do natural remedies, which I love natural remedies. But as you can see, when you've got a situation where actually that pain isn't normal, it's how do we then start to educate those families that that child needs medical help. And it's really important to recognise that actually sometimes people would defer not to go. I could definitely remember being told by, don't let that doctor do anything, or give you any hormone tablets or anything, the periods will never come back, that sort of thing, because there's some mistrust within the community. So within any education programme, it's really important to address that and recognise that.
I suppose it goes back to Catalonia work as well, that the pharmacist, training the pharmacists. And we, as part of this Erasmus work, which Chantal was involved in as well, we were in Catalonia and we visited a pharmacy and they showed us the products, and they were really educated, well educated about the products and how to use them, but also as well another healthcare professional as opposed to the doctor or the nurse who could kind of talk about periods and stuff. So do you want to say anything about that, Tanya?
I was just going to emphasize the potential for pharmacists to be period ambassadors and to spread knowledge on the products. And we envision pharmacists to be a sort of tapper sex exhibition, not with sex, but with menstrual products, because people who might be shy, might have deeper taboos, but happen to go to a pharmacy to buy whatever medicine or a packet of smins, right? Seeing the products shown to another person, right? This person might just listen to and then maybe touch it, right? So it's a way to gain more spaces. Also, the pharmacists were so appreciative of them being recognized as community health agents that have engaged in sensitizing actions well beyond what the government had commissioned them to do. So in many cities and towns, they are the ones going to schools and high schools saying, hey, families, do you want to organize a session on menstrual products and we'll present you the products, but at the same time, they are offering all this counseling. So it's been amazing. It's been an amazing experience to work with pharmacists. So this is something I would recommend to other countries as well, to engage pharmacists. Yeah,
definitely. Is there any more questions? We've got time maybe for one more question, 2 more questions. Yes.
So I had a tongue-in-cheek question.
Do it.
Tongue-in-cheek question, then a serious question. Mind you, my tongue-in-cheek is a serious one. So if we told men that vaginas have microbiome, and you may get that plastic, you think they'll change things? Maybe that should be the headline. So that's my tongue-in-cheek. My other question, I had 2 questions, but the one is about how, so religion, we talked about intersectionality, and sometimes religion ostracizes women that are menstruating. You become untouchable, you can't access certain places, nobody talks about it, etc. And then if women do need some help, their husband, who is now their chaperone, takes them to the doctor and speaks on their behalf to the doctor. So I think it's really important for those professionals who have got access to women where they are finally being allowed to go and talk to someone, that there's that confidence in those professionals to tell the woman, tell the man to be quiet, basically, have some interpreters or whatever they need to let that woman speak and speak about her body and what she's experiencing, etc. And I think in some places it's better than others. So is there, I'm sure your answer, Karen, is going to be yes. In the health service, they do recognise that.
Yeah, no, 100%. And we operate that within a system within maternity that we at some point get the man to leave the room in some funny way so that we can speak to the woman directly. But within gynaecology, there are clear policies in place that mean that we need to get an interpreter. The husband can't interpret, actually. So that's something that we're very much on top of, hopefully.
Thank you. And so really feel privileged to be amongst a group of such influential women. And we are, so the 3 of us here, we're from the London Borough of Barking Dagenham, and we're really privileged to Helen, who did an event at our council about sustainable menstruation, etc. So we would like to be, well, we are activists, but our biggest male activists here, Sushant, has been really fantastic, but we would like to make some change in our council. And I'm really interested about that we could maybe have a menstruation policy or something that we could do. And I'm really interested in Tanya and any advice and support you could give us about what this, especially like you mentioned about in schools, there's money. Nobody's got money. Now, Barking Dagenham definitely haven't got any money. And, but if there's money from the government that we could encourage or encourage schools to have these reusable products or whatever we could do at a local council level, we'd be really happy to get some advice and guidance, and any advice you can give us now, that would be fantastic.
Amazing. Yeah, so schools, the problem with the free product scheme is that schools have to opt into it, which is a bit frustrating, but all schools should have access to free products, reusable and single use. So that's the first thing. And there are great organisations as well that actually have stocks of products. Freedom for Girls, for example, if you get in touch with them, they could probably provide you with products. And also a project I'm about to start, I think will be really relevant, is I'm about to work with a couple of organisations who are faith-led organisations to create menstrual health resources. And it's going to be completely community-led. Basically, as the university person, I've essentially just been the money and the research. But these materials are going to be with sisters and diversity are going to consult with communities on what they want in the resources, what they want to be included in workshops around them, and we also have funding for translation as well. So I'd be very happy to stay in touch with you about that, and I could share those resources with you when they become available, hopefully next year.
And one other possible avenue to consider is the school nurses. And thinking of a program that you set up where they become almost like menstrual health champions. So, I mean, you're the council, so you have the power to mandate actually that every school nurse should go through your program. And then within that, you can include a certain set of resources as well as awareness of what's available, what they should teach, and as well as the ability to pick up when girls are in trouble with their menstruation and recommend, obviously, referral on to doctors as well, together with that real, you know, within it, that equity lens, so that they understand the intersectionality around a sort of religion, race, and cultural awareness. But you could develop the first program in the UK and then pass it on to the rest of us.
I'm looking at the time and I'm afraid we've kind of come to the end of the evening. I'd just like to ask the speakers for one word as to why we need a menstrual health a Menstrual Health Dignity and Sustainability Act going forward.
Okay, not one word, but we have to value every person in our society. And at the moment, we're not valuing women and girls and those who menstruate enough, which is evidenced by we're hearing lots of things that we'd like to see happening that are starting to happen. But why haven't they happened up to now? So let's value everybody and the contribution they can make to society.
That is one word, value. Great. Maria?
Yeah, I mean, women, gender minority groups are more than 50% of the planet and either have menstruated, currently menstruate, or will menstruate. So there's actually, you know, I've been told in the past that because I do research about menstruation, it's niche. It's not. It really isn't. It affects half the planet directly, the other half indirectly. So this is an urgent matter that.
So not niche. Great.
Yeah. Gender equity and climate justice.
Tanya, one word for why
that
we
would
need
be that would be justice. And then it can be adjectivized as gender justice, social justice, racial justice, climate justice.
Brilliant, brilliant word. And Karen?
I would say protect the human race, protect our future, protect our bodies, protect the future of the world.
So we got protect, value, not niche, and justice. Brilliant. Now I have to just say a few thank yous, and I'd like to start by saying thank you so much for our panel for coming together and sharing their expertise, their knowledge, their insight, and all their learnings around the work they've done. We really, really appreciate it. So big round of applause for it. I'd like to thank all the Wen staff who were involved in this work because a lot goes on behind the scenes. There's a lot of preparation and time, and I'd like to thank Kate Metcalf, Kate Beard, Heidi, Rashini, Donna, Zarina, who else is here? And Brian and everybody else that kind of came together and volunteered and made this happen basically tonight. And I probably left out people as well. Oh, Zolfa as well, Alice, and I can't, anyway, too many to mention, but thank you very much. I would like to thank very much to Amnesty for letting us have the event here and also for their tech support. It was really, really good. I'd like to thank you, the audience, for coming and staying and asking such great questions and listening and giving of your time. And I would like to say that we did get signatures from organisations for this act, but now we're asking for people to pledge to sign up as individuals for this act. So all the information is here and on our website. And we launched this campaign as well in connection with our act, Break Up with Toxic Periods. And it's again looking at urging people really to break up with the period products they're using and look at safer options and reusables. And again, there's a lot of information on our social media. Please follow us, support Wen any way you can, spread the word. And thank you very much for coming again. Thank you. I forgot to thank our stall holders. Thank you very much as well for the stalls. So thank you.